Okay, good afternoon, everyone. I had alluded to doing some book reviews, so I'm going to start chipping away at these. We do have a lot of new members, so I thought this was the most relevant of the books that I've read so far, for people who are just starting out and trying to figure out what do I do? I want to do something. What do I do? What can I do? What are some of my options? What are some of the risks that I'm assuming or not in some cases? Is a lot of these are repurposed drugs, and vitamins are incredibly safe. So with that, I will start off. So this is Cancer Care by Dr. Marik, and hopefully it's not backwards when it comes up, but here's the one. So there's couple versions of this. This is the one that I bought on Amazon, and then this is what I downloaded off the website. It's the FLCCC Frontline COVID-19 Critical Care Alliance. So there's an alliance of doctors who are critical of hospital policy and COVID policy and all of these things that ultimately resulted in a lot of preventable and unnecessary deaths, as well as added sickness that again was preventable. So this network of doctors is still fighting for patient rights and physicians' rights to be able to prescribe prescribe what their patients need. So I'm going to start to go through. I have a list here. So I'd say first and foremost, what I love about this is that it is free. You can download this right now. It's 250 pages. You can start doing your Control F and start looking for ovarian, ovary, hormone, like some of these words that are associated with a lot of our diagnoses or our family's diagnosis. So yeah, first and foremost, this is free, this is fast, downloadable, and I had it printed and bound, spiral bound, so that it was easy. I like having two. I like having a PDF and a digital copy, and then to me, there's just nothing better than having a physical book in your hand. So the perfect marriage between the two is that I could go through and highlight, so that when I start reading it, then I can start adding notes to it, and it really allows for me to interact with the material in a way that helps me remember what I'm reading better. So so that is first and foremost why I recommend this. I had started following the FLCCC for long COVID injury, and so I actually had these downloaded about 2 months before my mom's diagnosis, so a bit serendipitous. I don't think that was coincidental that I just happened to have these on hand, and as soon as my mom got her diagnosis, I literally went upstairs to my room and I grabbed this book off the shelf and I started reading and highlighting and going through it. So this was my first cancer Bible. You can see all the tabs that I had along the side. I went through this and I went through it and I went through it, and I went on Amazon and I ordered. I went to Thorne Supplements and I ordered, so that this book this book was such a source of comfort when we were knocked on our butts. It's like, okay, like somebody has written about this, somebody has beat cancer, somebody has researched it, and this was a phenomenal starting point for me. Within this book, he does reference the metabolic approach, Dr. Thomas Seyfried, and Jane McClellan's How to Starve Cancer, Justice Hope's Surviving Cancer and COVID-19. So like there were a number of books that were referenced in here that I then of course purchased and chipped away at learning about cancer. One of the things that I think that is great about a book like this is he does a great job explaining the limits of conventional therapy. So he just, okay, within one chapter, you're like, wow, like conventional therapy really does have some limits that I should know about. So as a why, like why would you augment traditional chemotherapy and surgery? Why would you augment? Why is that not good enough? And this book answers those questions in a pretty succinct way. He's pretty quick about it. The power of the pen is helps you see the light in this case for me. So let's see. he does discuss what I consider some of the basic theoretical approaches to cancer. He talks about the conventional approach, which is your like flawed DNA model. It's called a somatic mutation theory. He talks about the metabolic approach theory. He does also talk about the cancer stem cell theory. So he does go through those, introduces those concepts. It does get a little sciencey. So I'd say if you're not used to reading these, just don't give up. I will show you in a second just some of the things that I did to kind of help keep me organized as I was reading. And then I'll show you at the end the system that I ended up going to, and after books and books and books, and what helped me keep some of these ideas organized and help me find the information that was relevant to ovarian cancer, find that a little more quickly. So we'll do that at the end. Let's see, he introduces pathways that are relevant. So he talks about the P53 Notch signaling. Is it the WNT, the WNT? The PI3K/AKT/mTOR pathways. Those are relevant to most ovarian cancers, so he does talk about those. The hedgehog and the IGF-1 pathways, again, those are generally relevant for a lot of ovarian cancers. So he does start to get into some of the details. And again, like I've had to read it a couple times, so like this, it gets sciencey. I'm not an organic chemist. I'm not a cellular biologic specialist. I don't know, but so that was a little much. So if I were to criticize the book, that would be one critique. It's just it maybe explain it a little better. So again, a key part for this was the discussion of stem cells and introduction of that concept that chemo, and as a mechanism for showing how conventional therapy fails, is that with the stem cell theory, that explains why chemo fails. And it simply doesn't get the slower growing cells that are infected, and that allows for resistance and for the cancer to come back. Let's see. Okay. I like how he breaks down. So in the downloaded one, so maybe the next piece is he updates it. So the book that I bought was from December of 23. And then when I downloaded it, this was December of 23. So 6 months later, there was already an update. If you go online and download it, there's another update. So another good thing that I like about this is that he's still at it, and he's still trying to refine what he put together. And as new science and new studies are coming forward, then he can modify his review of the available literature. So, and then he organizes it into, in this one, he even has a picture in the end. So he's got a bit of a graphic. It shows, the metabolic and lifestyle things of like, look, like something led to cancer. Now this isn't a, hey, judge myself and, oh, we should feel guilty about what we didn't, like, no, like something led to your cancer. What was it? And if we don't have that honesty with ourselves, and if we don't have the accountability with our actions and how some of our actions may have contributed to where we are now, then if we can't do that, then we probably don't need to go any further. But if we can be open and honest with ourselves about where we were, and we can be open and honest about how some of our actions contributed to this, then we can fix it. We're not victims here. We're not just unlucky. Like, something brought us here, and there's a very real likelihood that some of our actions contributed to that. So, unabashedly, he talks about like the, diet, exercise, stress reduction, like I want to say the mind, body, and soul, right? He hits on those in accordance with the metabolic theory, which touches on all of those topics as well. He calls them, he breaks into 4 categories: repurposed drugs and supplements. He calls them tier 1, tier 2, tier 3, tier 4. And so tier 1, strong recommendation, all the way down to tier 4, recommend against. So So he, again, has a graphic that lists it. And then I even had the summary page just tabbed. And so essentially what he did is I went down all the tier 1 repurposed drugs recommendation. Number 1, vitamin D, vitamin D3. And he talks about why people have typically are low on vitamin D. And again, low for what? Like, is it low for some parameters that a lab tells us is low? Or is it low for what we as human beings need for optimum immune function? So he does split that up a little bit of like, look, what we have may be quote unquote fine, but it's not what you need to be your best self. And so he recommends what I thought was a pretty aggressive vitamin D regimen, up to 5,000 IU daily. Ooh, like that sounds like a lot. But he explains it, and he talks about a range, and again, is choose how you want to take this information. That's for you to decide. But he's done the work to compile it, and he talks about doses, melatonin, green tea, metformin, curcumin, mebendazole. Like, because of this book, I went down the checklist, and my mom was on almost all of these within 2 weeks. We did need to get some prescriptions through her primary care because her oncologist does not help her. I hate her oncologist. Anyways, so again, just it is quick. You can read it. There's recommended doses. There's why. There's discussion. He talks about contraindications of, okay, for curcumin, and some of these are blood thinners, so be careful with surgery. So as far as giving you like what I think of like a pretty solid quick reference, to me, this is the best. If you want to get started today, download this today, and that would be a good, certainly it'll get you in the right direction. So again, this particular book means so much to me. Dr. Marik was one of the co-authors on that latest study that we just posted in the group today, that had pretty high doses of mebendazole and ivermectin and some of these other vitamin D, right? So we're seeing some reoccurring themes in some of the things that he is seeing and some of the research that he's involved in. So I'm quite excited to see more from him, because in my opinion, he qualifies as a pretty ardent patient advocate, which is what all of us need, especially from the physician, the doctor side of the house. He's not an oncologist, he's a physician. Okay, last thing that I like about this, at the end, he does talk about different integrative approaches to some of the chemo side effects. You'll see these in Dr. McKinney's Integrative Oncology 3rd edition. You'll see some of these, but he does give them a mention here. And he has a whole host of pictures and other things that help you visualize, okay, what works, what is chemo doing for me. Here he has ovarian cancer listed as like, well, ultimately, if we were to boil down chemotherapy, like, why are we doing this? And he has an ovarian cancer listed as improved survival. So for ovarian cancer, he has it improved survival, but it's not in the cancer curable column. And at least it's not in the palliative care column. I take that back. He does have ovarian germ cell listed as chemo can cure ovarian germ cell. So again, with that, this is my review. Highly recommend it. And he introduces metronomic dosing, goes into other integrative approaches, phytodynamic therapy, hyperbaric oxygen therapy. So just a lot of good information here. So if you're looking to get started, then I think this is where you go. Second mention, and I discovered this later, and that's the FenBen support group. They have a protocol listed as well. So if this isn't your cup of tea, you can also go into the FenBen group and pull up their protocol and start start putting together your protocol. As always, monitor your labs. If you're on antiparasitics, make sure that you have some type of binder with it. We use apple cider vinegar. Some people use activated charcoal. Before you dive into activated charcoal, just make sure that you're not that's separate, and you've done your research on that, or you ask the group and make sure that you're not starting that without without some guidance first. And then always support your liver. So your serrapeptase, maybe some milk thistle and some tudka. So as you're killing things off, you have to keep track of your lymphatic system, and you have to keep things moving so that you don't get the buildups that you don't want. So, okay. So with that, feel free to post questions. Let me know what you think, and stay tuned for the next book. I'm going to do, oh, sorry. You know what I forgot? It was how I keep track of what I'm researching. So the next book is going to be Mark Lintern's Cancer Resolution. You put a question mark on there, and I love that. But I will say, as I go through the book, I'll let you see, I just put notes in here. So here's further study. So if he uses a term that I don't understand, I write it down, and I put the page number. Supplements. So supplements that interest me, I put that down with the page number. Labs. So when I talk about what are the different labs that I want my mom to ask for, and then I can just feel the eye rolling of her oncologist as we send that email and ask for vitamin D labs and other crazy things like that. So different labs. I have done this with How to Start Cancer, Metabolic Approach, and now this one. So when I want to know about labs, I just pull open those books and I look at those three. And this is my table of contents, really. Let's see. Also, I started doing some of these books, if there's a specific ovarian cancer mention, a lot of them don't have it in the index. So that kind of disappoints me a little bit, except that as I'm reading, I keep track. So ovarian cancer was listed here a few times. So as they are listing that, then I put that there. Okay. And then you can see on the cancer care book, another thing that I do is, like, as I'm reading and I don't know what something is, in this case, I used, because I had the PDF open and I was just typing away. If there's something I don't know, I look it up and write it down. I'm going to have that question again. Once I write it down, I'm not going to remember it the first time. When I go back to that book, I'll see it and aha, there it is. I've already written it down. So in this case, I looked up hepatocellular carcinoma, HCC, and that apparently is a common form of liver cancer. Didn't know that. Now I do. So when I see that, I'm now at least more familiar with those terms. So that's how I start to grow my familiarity with the language and the terms, is like, you just got to chip away at it. If you were to ask me what hepatocellular carcinoma was before I started this video, I'd say, ooh, I don't really remember. I know I've heard of it. But it's things like this, it's multiple reps and sets of going through some of these terms that help transition that short-term memory into long-term memory, and we call that learning. So, okay, so that's Down and Dirty Cancer Care by Dr. Paul Marik. Again, and let us know what questions you have. Take care. Love y'all.